this video is going to talk about, ICU nursing, a lot of frequently asked questions that have been asked throughout the years about, ICU nursing. So definitely if you want to learn a bit more about that, definitely keep watching. My name is Christine and welcome to new videos. If your first time here, you want to become a CRNA or grow your CRNA career, start out by subscribing here so you don't miss anything. ICU nursing is amazing. It gives you a foundation. It gives you a skill set that can take you anywhere. Initially when I was a nurse, I wanted to become a psych nurse because I wanted to become a psych nurse practitioner. However, if you do want to do that route, you have to have a minimum of a year in regular nursing. They will not accept you. So for me, I decided ICU nursing because I did an externship/internship, when my junior year of college. So I kind of knew ICU nursing, I kind of knew a little bit about it, I kind of liked it. And so it was always a backup plan. So I always believe in not always going for one route and not having a backup. Always have a backup just in case. You always want to keep yourself just in case, okay? So I knew I wanted to become a psych nurse practitioner, but I went into the ICU, got that experience. Now, doing ICU, I really got a skill set that no one can take from me. So I loved it. And so a lot of people say to me, was ICU nursing worth it? Yes. If you can get into the ICU right out of college, being a graduate nurse, going right into the ICU, I definitely recommend it. If you want to go into the ICU, don't wait. There's a lot of teaching institutions that will actually have residency program. For example, I went to NYU Langone Medical Center in New York City, and I did a graduate nurse residency program. So it was also for ICU nursing, but it was also for many different areas in nursing to help us nurses the first year to be successful. We had lectures, we had, I felt like we had a lot of support. And so I definitely recommend if you are able to be a part of a residency program at a teaching institution, even if it's for 1 year, I definitely recommend it. And especially in ICU nursing, I think it's essential that you have that. You need to have that support because there's a lot of information thrown at you in a very short period of time. And you'll be taking care of patients who are critically ill. And I'm telling you, by the time you're done with your first year of your residency program, you're going to be very well adapted, have a foundation, and also be successful. As long as you work hard and you never give up, you can do anything. I don't care what anyone says to you, you can do it. And so I believe in it. For example, for me, another question someone said, was it hard for you when you were in ICU? Was it easy or did it happen naturally? So to be honest with you, it was very difficult. The most important thing about it with me when I was in the ICU for my first year of the residency program, my preceptor and I did not really click well. I felt like I wasn't learning. I felt very stressed. I was very unhappy. And so I had to talk to my nurse manager and I had to make a switch. And I switched to a person who was amazing. She was a ICU nurse for years. And it's so funny. She was actually the nurse that was basically helping me when I was an intern, when I was in nursing school doing like an internship. She was actually the preceptor that was precepting me initially. And then when things didn't go well with my new preceptor, it just didn't flow right, she ended up being my preceptor again. And that was okay because even though you may be with someone you feel like this is very difficult, I'm not able to progress, I can't do this, maybe you just need to switch preceptors. And that helped me a lot. And so when I switched preceptors, yes, I got the knowledge and the foundation, of course, what we got with lectures, but I also got the support. And she really catered to me, because everyone's different. Everyone learns in different paces. And, it took me some time to understand certain concepts, taking care of certain patients, doing certain procedures, and putting things together. Because she was an expert. She walked into the room. She didn't do anything, just walked into the room. She looked at her surroundings and she pretty much knew what was going on. And she kind of could tell what the next step would be. Okay? Pretty much. When I walked in the room, I still was kind of figuring out all right, what do I do first? Trying to understand what's my priority, and what's going on. I was still a brand new registered nurse. Because I felt when I was in nursing school, for me, this was years ago. So things have probably changed. I felt like I wasn't fully prepared in a sense with nursing. Like I felt when I started nursing, working nursing, I felt like it was a big transition for me, especially with patient care. So if you are going through that, it's normal, and it happens to us, and you may just need to push through it. But definitely get a good preceptor who is going to really guide you during that first year, because it's going to be difficult. Definitely going to be difficult. But you're going to do it. You're going to do fine. Within 6 months, you're going to feel like, wow, I broke through it. And then after a year, you're going to feel like you got this. But you just got to push through that first 6 months to a year, and things will get better. And it was hard for me, but I can help you too. So another frequently asked question is, okay, if I go into the ICU, do I need 1 year? Do I need 5 years? How many years of experience do I need in order to become a CRNA? When you think about going into the ICU, depending on the program, it could be 1 year of experience that you might need. But a lot of the programs nowadays looking at you need a couple of years of experience. However, there are rare occasions, depending on the ICU experience you've received, that you can get into school within 1 year. Depending on what type of teaching institution you worked at, what type of experience you got. Did you get the sickest patients? As well as if you got your certification in critical care, that's important as well. Those are some things that can make you expedite your getting accepted into a CRNA program faster compared to other students or nurses as well. Another question people ask me, which ICU should I go into? Should I go into surgical? Should I go into medical? Should I go into critical care? Should I go into cardiovascular? Should I go into neuro? So to be honest with you, it's about your experience. Like for me, I was in the medical ICU. I went into surgical ICU. I did a little bit of cardiovascular ICU nursing. I pretty much was mainly medical and surgical, and then I kind of floated around in the other ones. But I feel what's most important is the area that you work, feeling comfortable, really getting good experience, getting really sick patients, really learning critical care management, getting the sickest patients on a unit on multiple drips, for example, with a lot of comorbidities. I think that's the most important thing. I don't believe that there's one specific area that you're going to get accepted into. Oh, I'm going to be a cardiovascular ICU nurse, or I'm going to be a medical ICU nurse, and I'm going to guarantee to get into CRNA school. I mean, honestly, that's not true. It depends on your experience, and which nurses get accepted versus others. I don't feel there's a specific answer for that. I think it's your ICU experience and how active you are on your hospital. Maybe you're an ICU nurse, but you're also becoming a charge nurse. You're also part of the code team. Maybe you're part of different quality improvement measures. You're being a part of rounds. Maybe you're doing some research, being involved in research. Also, being a part of committees, those type of things really help you with your ICU nursing experience. And I feel that that's something you got to consider when you're thinking about, ICU nursing and the best experience for you. Another frequently asked question was, hey, I am an associate's prepared, registered nurse, and, I'm not a bachelor's prepared nurse yet. I do want to get my bachelor's degree, but, can I go into the ICU? Yes, even though you're a registered nurse that's associate's prepared, if you have the opportunity, depending on the hospital, I would definitely recommend you going into the ICU, getting your experience. Now, while you're in the ICU, getting your experience, definitely take the steps to get your bachelor's degree by taking classes and getting your bachelor's degree in nursing. So you're getting your experience, then you're working towards your bachelor's degree. It's a win-win situation. So by the time you get your bachelor's degree, maybe you have 1 year, 2 years experience, then it gives you an opportunity to apply to CRNA school because you've met that requirement. You've killed 2 birds with 1 stone. So I definitely recommend you doing that. Another question some people have asked me is, should I take the critical care certification exam? Do I need that? Maybe I don't have to take it. To be honest, even if you are thinking about going into a program that doesn't require it, a lot of programs, even if they do not require it, it looks really good on your resume, to have critical care certification under your belt. So I definitely recommend you taking your CCRN. No matter what, I really recommend within 6 months of you being in the ICU, start working towards it, as well as making sure you have your ACLS, BLS, and PAL certification. Even though you're not in pediatrics at the moment, maybe you're in adult ICU, you still will need the PALs for CRNA school, because when you are in school, you're going to work with all different patients. You can do pediatrics, adults, geriatrics, different areas, and that's definitely something you want to have under your belt in order to become, to go into CRNA school. Another question I've asked was, do ICU nurses get paid well? Well, when looking at the numbers, when I've done a couple of videos, definitely have a video on ICU nurses' salary, so definitely check that out. But ICU nurses do make a very good salary. I mean, nursing in general, you make a very good salary. It's a very good area to go into. I feel you have a stability when you're thinking about finances. And so I feel, and you'll always have a job. There's so many job opportunities in nursing, travel nursing, administration. You could be an educator. You can do, electronic health record. I mean, you can do ICU nursing, you can do pediatric nursing. You could do so many things and so much more. So if you don't like one specific area, for example, you can go into another specific area. So, but in general, ICU nurses do get a great salary. Now, also depends on the hospital you're working at. Because when I worked at a teaching institution, I was almost making $90,000 a year base salary. But that wasn't just for me being an ICU nurse. It was also all the nurses, who were just starting in the ICU. So, it all depends on the specific institution. But when you think about travel nursing, for example, I've seen that travel nurses who specialize in ICU nursing, there's a high demand. So naturally, you will get a higher salary compared to many different areas because you're needed, and it's very competitive to find an ICU nurse that will travel. So that's one of the things I definitely recommend you doing if you decide to not know for sure what you want to do. Traveling, I heard it's a really good opportunity to get a great salary. How was the interview for, ICU nursing? Was it difficult? So when you're thinking about nursing in general, it's just like any job you're thinking about going into. They're going to ask you things about your schooling, your experience, why you want to go into the specific unit. They're definitely they're going to look at your grades, and it all depends on what institution you want to work at. Teaching versus a small hospital, there's going to be different types of questions asked of you. I definitely have videos on interview questions in regards to nursing, ICU nursing, so definitely check that video out. So I hope this video helped you, and if you have any other questions, definitely put in the comments below. I would definitely love to hear it, and if I can't get to it, there's definitely going to be someone who will definitely love to kind of have a conversation. So if you want to learn more about CRNAs, how to grow your CRNA career, definitely get one of these videos over here, and I'll see you in the next video. Thanks for watching.